Dentistry, transforming your health for a lifetime.
You've paid your dental insurance premiums all year. You've earned your dental benefits. Don't let them slip away before your remaining benefits expire at year's end. Welcome to Complete Health with Dr. Mike Rogers. I'm your host, April. With me today to discuss using your benefits before you lose them is our insurance coordinator, Joyce. Good morning, Joyce.
Good morning, April. Thank you for having me.
I know it's almost the end of the year again, and everyone's calendar's filling up quickly. Even with a busy schedule, it would be worthwhile to add a dental appointment to your schedule. Did you know that you may be throwing away hundreds of dollars? And in today's economy, it's especially important to maximize every dollar you can.
It's true. Most dental insurances reset at the onset of the new year, and any unused benefits will disappear. By using your dental insurance benefits before the new year starts, you could be saving yourself hundreds of dollars. There's a lot of unforeseen things that can happen. Bad weather, sick children with cold and flu season approaching, or even unplanned mishaps and repairs. It's much easier to plan ahead to schedule a dental appointment to be proactive in your care. There's nothing worse than a broken tooth or even pain over the holidays.
That's so true, because a new year wipes the slate clean. While that's a good thing for your resolutions, it can be a missed opportunity for your dental benefits. Joyce, you've been working with our patients and their dental insurance for over 20 years. Can you discuss with our listeners some of the main reasons why we are discussing Use It or Lose It today?
Well, April, many people with dental benefits get them through their employers, though individual plans are also available through the health insurance marketplaces established by the Affordable Care Act. Remember, when you buy a plan, you and your employer are paying some premium, upfront dollars that are wasted if you don't see your dentist.
When do you need to use them by?
Many insurance companies have a benefit deadline of December 31st, and this means that any of your unused benefits don't roll over into the new year for most dental plans. Still, some plans may end at different times of the year, so check your plan document or ask your employer to be sure. April, we both know that most employees offer vacation time as a benefit that doesn't carry over to the new year. It's another use it or lose it. You would never dream of losing vacation time. The same should go for the dental benefits.
Wow, I never looked at it like that. I would never just leave my vacation expire. I wondered if you could talk a little about yearly maximums.
Every dental insurance plan has a yearly maximum, and this is the most money that the plan will pay for your dental treatments within one full year. While the amount varies among insurance companies, the average is around $1,000 per person per year. The yearly maximum usually renews each year on January 1st. These benefits do not roll over to the next year and must be used by December 31st. So if you have unused benefits left for 2018, remember that by January 1st, 2019, they will be forfeited and lost.
Yeah, back in May, we did a radio show explaining insurance and talked about the dental insurance came out in the 1950s with $1,000 a year maximum.
That's right, and sadly enough, it hasn't changed.
What about deductibles?
The deductible is the amount of money that you must pay to your dentist out of pocket before your insurance company will pay for any services. This fee varies from one plan to another and could be higher if you choose an out-of-network dentist. However, the average deductible for a dental insurance plan is usually around $50 a year. Your deductible also starts again when your plan rolls over.
Why is it a good idea to use your benefits by year end regarding your deductible?
If you've already met your deductible for the year, even if you're close, it's worth squeezing in non-emergency care. You'll pay lower out-of-pocket costs. If you wait until next year, you'll have to meet your deductible all over again.
So if I get all my treatment done and pay my deductible this year, and all I need is a cleaning next year, I won't need to pay another deductible, right?
That's correct, April. Also, did you know that most dental plans cover preventive procedures at 100% with no deductible?
I did not know that. What does preventive care usually cover?
Well, typically it includes routine exams, x-rays, fluoride, and cleanings. If that's all you need next year, you could save the $50 deductible. Treat your unused benefits like a coupon that's about to expire.
That's a great analogy. Joyce, can you talk a little about insurance premiums and the best ways to take advantage of them?
Sure. Monthly premiums are already paid, whether it be by you, your company, or a little from each side. Put that money into action and use your benefits to get what you paid for. If you do not use your benefits, your insurance company takes that money away from you and puts it straight into their own pockets. Remember, insurance companies are in the business to make money. Even if you don't need any dental treatment, it is still important to get regular dental cleanings to help prevent and detect any early signs of cavities, gum disease, oral cancer, and other dental problems.
I'd much rather use my insurance than let the insurance companies make money.
Absolutely.
Well, what other reasons would you want to take advantage of your insurance benefits before year end?
Well, another reason to use your benefits before the end of the year is possible fee increases. This can be fees at our office due to increased material costs, but most importantly, some dental insurance companies raise their rates at the beginning of the year due to the increased cost of living, materials, and equipment. A fee can increase and can make your copay even higher.
That is a very valid reason. I know we just received our new health insurance contract for 2019 at Complete Health Dentistry. Not only did our premiums increase, but our copays did as well. And we never had a deductible before, but we now have a $500 deductible a year per person for medical.
Wow.
I made sure I scheduled my physical before the end of this year, so hopefully I won't have to use my insurance next year with the $500 deductible. So, Joyce, I know you have one more reason why you should use your insurance before it expires. Can you go over that with our listeners as well?
Sure, April. The last reason is the most important. Dental problems don't get better over time.
Isn't that the truth?
It sure is. Many patients need dental treatment, whether it's a professional cleaning of your teeth or restorations to treat bad decay. By postponing a dental treatment, you're risking more extensive and expensive treatments in the future. Addressing dental issues now rather than putting off treatment can prevent problems from getting worse, which could save even more money compared to waiting. What may be a simple cavity now could turn into a root canal or even tooth loss later.
Wow, that is a very important reason to use your insurance. You are listening to Complete Health with Dr. Mike Rogers. When we come back, we will continue our discussion with our insurance coordinator, Joyce, about use it or lose it.
Complete Health Dentistry, transforming your health for a lifetime.
Do you have unused dental insurance benefits or flexible spending left for 2018? Did you know that dental insurance benefits and flexible spending have a use it or lose it policy? 2019 is right around the corner. Benefits not used this year do not carry over to next year. Call Dr. Michael Rogers today to schedule your appointment for a wellness visit, treatment, or a new patient experience to take advantage of your unused benefits. Call 570-253-5000. Appointments are limited and filling up quickly. Visit us on the web at CompleteHealthDentistry.com.
Complete Health Dentistry, transforming your health for a lifetime.
Welcome back to Complete Health with Dr. Mike Rogers. Before the break, we discussed reasons why you should take advantage of your insurance benefits before year end. Now we want to share with you insurance plans provided by local businesses that we participate in. Joyce, I thought you'd like to be the one to share this exciting news.
April, I would love to. I'm glad to share that we now participate in dental insurances from the following employers: Wayne Memorial Hospital, Honesdale National Bank, Woodlock, Leeward Construction, Suburban Propane, Federal Express, Lowe's, Home Depot, Monticello School District, and St. Mary's Villa.
That's awesome, and we're adding more regularly. So if you are employed at any of these businesses, give our office a call. If you have dental insurance, but you're not sure if we participate, that's where Joyce is the expert. Give her a call today at 570-253-5000. Now, I want to talk a little about health savings accounts and flexible spending. Could you explain that for our listeners, Joyce?
Sure, April. This is money that's taken out of your paycheck pre-tax, and it's held in an account to be used for medical or dental expenses not covered by your insurance. You are usually given a debit card to use these benefits at your dental appointment. The great thing about this benefit is you don't need dental insurance to have a health savings account or flex spending. If you participate in flexible spending or health savings account, in most cases, money left in these accounts at the end of the year is forfeited. These are benefits that you have paid for. Make sure to use them before you lose them.
Great advice.
Thank you. For our listeners that have a dental wish list, things such as whitening, implants, veneers, or anything else you might desire, you can plan for these using your health savings account or flexible spending account for next year. It's all about being proactive.
So although dental treatment is never dictated by an insurance policy, our experience has shown that careful planning can often help maximize your benefits. Call us today to make sure you get an appointment before the end of the year. We look forward to hearing from you. So Joyce, I want to change gears just a little bit. So hypothetically, I'm looking to use my insurance benefits by year end, but I'm putting it off because I know I have to also pay a portion out of pocket.
Well, that is a concern for many of our patients, but that can sometimes be a problem, and many people postpone needed dental treatment due to finances.
So you have been known to help our patients through the financial portion of their dental treatment. We offer many payment options at our office. Can you go into that a little bit?
Sure. We offer a 5% accounting courtesy if paid by cash or check at the time of scheduling. We also accept all major credit cards, and we work with Care Credit, where we offer several options that Dr. Rogers pays the interest for you.
And I know we also have an extended payment plan with that also that does have interest, correct? If you need smaller payments?
Yes, and it spaces them out over longer periods of time for you.
Great. Thank you, Joyce. We know that good oral care habits are more than just your teeth. A healthy mouth means a healthy body. And that's why it's so important to see Dr. Rogers regularly. Those visits can help prevent and monitor dental health issues that could lead to more serious conditions and also require more expensive treatment, such as cavities, tooth removal, root canals, and even oral cancer. But shopping for a dental plan, or any type of healthcare coverage for that matter, can be an intimidating process. I know there are endless options to choose from with different types of plans and levels of coverage and costs. Even when you think you know what type of plan you want, the paperwork can be full of unfamiliar terms and acronyms that make the terms of the plan hard to understand.
That's true. Dental plans also function differently than most health insurance plans, which adds another layer of complexity to the process. But don't worry, I've got you covered. I can help you find resources to help you through every step of the way, including figuring out how much coverage you need, what common insurance and dental terms mean, and I can offer additional resources for finding affordable dental coverage.
That is true. You do offer all of those. And another thing that you do for our patients that have insurance that we don't participate in is you submit everything for them. So if you have dental insurance that we do not participate in, we can still see you. You still can be a patient at our office, and we will submit everything for you, and then your insurance company will reimburse you.
Absolutely, as long as you can go out of network with your plan.
Okay. So with the end of the year steadily approaching, your dental benefits are approaching their end as well. Most dental insurance plans are just sitting there with your benefits unused and ready to go to waste or in the insurance company's pocket as soon as the clock strikes midnight on December 31st. In fact, if you can believe it, dental insurance companies bank on making millions of dollars off of patients who never use their insurance benefits. How? Why? Well, many consumers have no idea that their plans provide coverage up to a certain dollar amount annually.
That's right, April. The key word is annually. Annually, which ends in a little over 2 months. At Complete Health Dentistry of NEPA, we are here to remind you to use your benefits. Use them now. Your insurance company is not going to give you a courtesy call, but we will.
And if you're looking to use your benefits but are seeking out a new dentist, you may be asking, why Complete Health Dentistry of NEPA?
Well, at our office, here we strive to make our office as relaxing and comfortable as possible. We offer warm neck wraps, blankets, essential oils, aromatherapy, sedation dentistry, nitrous oxide, relaxing music, noise-canceling headphones, and a fun-loving team.
We sure do.
Absolutely. We treat our patients like family. Treatment is tailored to your individual needs. We believe that informed patients are better prepared to make decisions regarding their health and well-being.
And we are proud to offer all these services under one roof. No need to go anywhere else for your dental work. And as a reminder, if you have any treatment you have put on hold or are due for a good thorough cleaning, now may be a good time to schedule an appointment to maximize your insurance benefits and use any remaining flex spending or health savings account dollars you may have. Do not wait until December to reserve an appointment with Dr. Rogers. Treat your teeth with care now, and they will thank you for it in the long run.
If you're not sure if you have any benefits left, just give me a call and I'll work with your insurance company to see what you still have available for benefits this year.
Yes, give us a call today and take advantage before the end of the year insurance benefits expire. You may reach us at 570-253-5000 to set up your appointment today. Our office is conveniently located at 3373 Lake Ariel Highway in Honesdale. We're directly across from Roach Supply. You are listening to Complete Health Dentistry with Dr. Mike Rogers. Stay tuned as we will discuss some of our upcoming events and also how to keep your mouth healthy during this Halloween season.
Complete Health Dentistry.
Halloween is coming, and normally it's hard for Dr. Rogers to be excited about all the candy his patients will be eating. However, this year is different. Don't you just wish that on the day after Halloween your kids' candy will just disappear? Well, we can help. Complete Health Dentistry will be hosting our 6th annual Halloween candy buyback. We will buy the candy back from your kids. We're not kidding. The candy will be distributed to our troops through Operation Gratitude. In return, we'll give your kids $1 per pound of candy up to 5 pounds and a Firefly flashing toothbrush. Bring your kids and your candy to Complete Health Dentistry on Route 191 South, November 1st from 8 a.m. to 6 p.m. and spread the word.
Complete Health Dentistry. Transforming your health for a lifetime.
For more information, call 253-5000. Welcome back to Complete Health with Dr. Mike Rogers. I'm here today with Joyce, our insurance coordinator, and we are back to talk to you about Halloween. So Halloween is coming, and normally it's hard for your dentist to get excited about that day because of all the candy your kids will eat. However, this dental office is different. Don't you just wish that on the day after Halloween that your kids' sacks full of candy would just disappear?
Well, we can help, and this is something we're very excited about. At Complete Health Dentistry of NEPA, we'll buy the candy back from your kids. We're not kidding. Sure, they can have a few treats on Halloween night and maybe even keep a couple more for later in the week, but we'll take the rest of it and pay them for it. The candy will be shipped through Operation Gratitude to our courageous troops serving our country overseas.
They sure could use a treat or two, huh, Joyce?
They sure can. And in return, we'll give your kids $1 per pound of donated candy and a Firefly flashing toothbrush.
Did you know that Operation Gratitude volunteers collected more than 400,000 pounds of candy last year, distributing it to U.S. troops serving far away from home and our veterans and first responders? They include sweet treats in every care package that's sent, and they're sending 300,000 this year alone. Halloween candy serves as a reminder of home that helps to bring smiles to our troops' faces. And you are helping make it happen by donating your candy today. This year, we're also collecting dental floss,
to keep those smiles minty fresh,
travel-sized toothpaste, pens and mechanical pencils,
and those are for our troops writing letters to their loved ones at home.
and of course, handwritten thank you letters and drawings for service members, veterans, and first responders.
April, global sugar consumption for kids increases by about 2% annually and currently sits at 50 million tons per year.
Wow.
Which means parents need to be very watchful now and more than ever before. Too much candy can lead to hyperactivity and weight gain, as well as cavities or worse. In some cases, the wrong types of candy can also lead to broken teeth and damaged braces.
So what you're saying is kids should still dress up, go out, have fun, and yes, even eat some candy. But after picking out the best of their stash, they will probably have about 10 pounds left, and nobody needs that much candy.
That's true. Bring your kids and your candy in on November 1st from 8 a.m. to 6 p.m. and spread the word.
So Joyce, what's your favorite Halloween candy?
Ooh, mine is a Milky Way.
How
about you, April?
I love Heath bars, and in my house, I'm the only one that likes them, so I get them all to myself.
Wow, that's great. So, April, let's talk a little now on how to keep your mouth healthy during this Halloween season. It's a pretty tempting holiday for both kids and adults. Dr. Rogers sent us with his recommendations for our listeners to stay mouth healthy during Halloween and every day.
So he did give a list, and the first one is to stay away from things that stick. And I know he also recommends chewing gum that has the American Dental Association seal.
Avoid beverages with added sugar.
Think twice before picking hard candies.
And finally, Dr. Rogers said if you're going to eat sweets, to try and eat candy with meals. We know how candy can be hard to resist, especially with all that hard work trick-or-treating for it. If you can, try and eat Halloween candy and other sugary foods with meals or shortly after mealtime. That's because saliva production increases during meals and helps cancel out acids produced by bacteria in your mouth and helps rinse away food particles. So, April, what about kids with braces?
Great question. So Halloween's a time for spooky stories, creepy costumes, and of course, that candy. Kids of all ages love to go trick-or-treating on Halloween. And don't worry, parents. Kids with braces can join in the fun if they choose the right candy during the holiday. When enjoying sugary sweets, you'll find quite a few that are just fine for children with orthodontic appliances. There are, of course, some exceptions. Those with braces should avoid sticky and chewy candy. The problem is that certain types of candy are very gooey and sticky and will stick in hard-to-reach areas in and around the braces. It's very difficult to remove and can cause inflamed gum tissue and decay. In addition to causing decay, the sticky and gooey candy can pop off the brackets, which hold the wires in place for the braces and cause an unscheduled visit to the dentist. There's still plenty of Halloween treats that kids with braces can enjoy. And when it comes to those treats, the team at Complete Health Dentistry has a few pointers for what may be best left behind, especially for those who wear braces.
What are the best choices for those who wear traditional braces?
Well, Dr. Rogers recommends chocolate bars. He says you can't go wrong with some pure, delicious chocolate. Whether you choose a candy bar or perhaps a Hershey's Kiss, chocolate dissolves quickly and is safe for braces. If you're lucky enough to score a full-size candy bar, we do encourage you to cut it up into smaller pieces to reduce the risk of damaging the braces on your front teeth as you bite into it. Peanut butter cups are another scrumptious yet safe option for braces. Their smooth consistency makes chewing very easy with really no concern of breaking a bracket or wire. And of course, Joyce's favorite, the Milky Ways. Even though they contain caramel, which we're going to talk a little more in a bit, they're still soft enough for brace wearers to enjoy.
Dr. Rogers said that all of these options are safe as long as they're not frozen. Frozen chocolate bars and peanut butter cups make the texture too hard to bite and chew safely with braces. April, what are the worst choices?
Oh, good question. So some of the worst choices would be hard candy. Hard candies allow you to suck them over time, reducing their size and making them less dangerous for braces. And they may be okay, but however, it increases the time your teeth are exposed to the sugar, which may put you at greater risk for decay. Also, gooey gum. Now, we did talk about the sugarless gum with the ADA seal, but there's a lot of other gum out there. And when you first got your braces, you were probably told to avoid gum. And that rule doesn't change during Halloween. Chewing gum can bend your wires, and that's particularly concerning. When a wire is placed by your doctor, it's put on in such a way that gently moves your teeth into the desired position. However, if the wire bends, your teeth tend to follow the direction of the wire instead of its original path, and this can actually prolong treatment. Sticky sweets are also not a good idea. Things like caramels, gummies, taffy, and similar candies are almost sure to cause some trouble. Sticky sweets and their tacky consistency only tend to bend wires. They're also bad for your teeth in general. The stickiness allows the sugars to stay attached to teeth longer, and again, increasing your risk for decay.
A very important note from Dr. Rogers. When in doubt, if it's sticky, hard, or super chewy, it's best to choose another option.
In order to keep your braces in tip-top shape and to avoid any broken brackets, bent wires, or other complications, it's wise to listen to your dentist about which foods are safe for braces. Halloween candy is no exception. Following our recommendations of braces-friendly candy can protect your braces and help you avoid an emergency dental appointment.
Just be sure your kids brush their teeth after any sweets and before going to bed.
You've been listening to Complete Health with Dr. Mike Rogers. Remember to bring your leftover Halloween candy to our office for our 6th annual Halloween Candy Buyback on Thursday, November 1st from 8 a.m. to 6 p.m. And also, I wanted to extend an invitation to everyone, whether you are an existing patient, have been a patient in the past, or are thinking about becoming a patient, to our holiday open house where we wrap up our year of celebrating 25 years in dentistry. It will be held on Thursday, November 29th from 6 to 8 p.m. at our office. We will have plenty of refreshments and door prizes. See you there.
Complete Health Dentistry.